Cruz said, I'm Julia Dvorak. The title of my project is Two Paths to One Breath, Investigating Oral and Nasal Respiration. I picked this topic because, like he said, I originally wanted to become a dentist. And this topic is something we rarely think about, but it affects nearly every aspect of our health. So thank you for being here today. The goal of my study was to compare the physiological differences between oral and nasal breathing while highlighting their effects on health and discussing the importance of early detection and intervention. Different breathing patterns may seem harmless, but over time they can influence facial development, sleep quality, and even athletic performance and cognitive function. So for a little bit of background, I think we should start by going over some anatomy of the oral cavity. The oral cavity and the nasal cavity develop concurrently. As you can see in this figure, the oral cavity is bound by the lips, the cheeks, the hard palate, the mucosa covering the superior surface of the tongue, and the sheet of muscles attaching to the inner side of the mandible. Next we'll go over the pharyngeal cavity because the oral cavity is continuous with the pharyngeal cavity. The pharynx has an upper part called the nasopharynx, and then it has a middle part called the oropharynx that joins the oral cavity. And right below the pharynx is the larynx, and the tongue is in both the pharynx and oral cavity. Before we go over the anatomy of the nasal cavity, we should talk about the important functions of the nose. First is olfaction, which is your sense of smell. And then next is filtration, which is defense against infiltrating particles. And third is the conditioning of air, which means to humidify the air. So for the nasal cavity, it's often thought of as the front-line defender of the internal respiratory organs, and it serves as a communication chamber between environmental air and the respiratory system. There's two nasal cavities which connect with the upper part of the nasopharynx, and these are bound by the septal wall in the middle and then the lateral walls shown there. And then inside the nose are three turbinates that facilitate the humidification of air and of like the inspired air. And the nasal septum is rarely in the direct midline of the body. The air is either going to be pulled in from the mouth or the nose, passed to an area of the pharynx, and then moved to the larynx, trachea, and bronchial tubes, and then bronchioles. Next, we should go over some of the histology of the nose to see how it has defense against infiltrating particles. So the inner surface of the nose is made up of these ciliated cells, which are loaded with mucus-secreting goblet cells, and then the cilia and mucosa help in the function of defense. Particles greater than 5 to 8 micrometers and about 50% of 2 to 4 micrometers are trapped in the ciliated mucosa. For comparison, the average diameter of a human red blood cell is 6 to 8 micrometers. And then these work together to propel the particles towards the nasopharynx within 15 minutes, usually towards the adenoids, which function in the... This is a study that was done to compare the efficacy of air conditioning for nasal breathing compared to oral breathing. There were 23 participants from 22 to 42 years old, and each person tested nasal breathing and oral breathing to make it more similar. Nasal breathing has been proven to be more effective than oral breathing at conditioning the room temperature air, and the oral respiration results vary a little bit due to how much the mouth was actually open. This study highlights how effective the nasal cavity is at warming and humidifying. The nasal breathing route conditioned the air to 32 degrees and 98% humidity, close to lung tissue temperature and optimal for gas exchange. Mouth breathing, on the other hand, only brought it to 30 degrees Celsius and 90% humidity. It might not seem like a big difference, but for sensitive lung tissues, the extra moisture is crucial. And the thin slit shape of the nose allows for close contact of inspired air and the mucous membranes. One quote from the study was actually, "A single sniff changes Scandinavian winter to Florida summer." There are 3 types of mouth breathers. The first is the organic mouth breather, which is someone who has a mechanical obstruction, which makes nasal breathing more difficult. Examples of this mechanical obstruction were the deviated nasal septum, which was shown on the earlier slides, and large adenoids or chronic sinusitis. Next is the purely functional mouth breather. These are ones who generally are partially breathed through their mouth, even though they have no mechanical or pathological obstructions for nasal breathing. Third is the special needs mouth breather. One is called a special needs mouth breather when they have a neurological disorder or dysfunction associated with mouth breathing. If you try breathing through your mouth for just a few seconds, you'll feel your chest rise and fall more obviously than it would when you breathe through your nose. And mouth breathing is often called chest or shallow breathing because it's performed with more chest muscles only occupying the upper 2/3 of the lungs. On the other hand, nasal breathing is known as diaphragmatic breathing because it moves the diaphragm, which is located at the base of the lungs, and the diaphragm contracts, causing the rib cage to expand outward and downward, and this allows the air to fill the entirety of the lungs. Breathing diaphragmatically allows the air to reach the alveoli located at the base of the lungs, and compared to the alveoli at the top of the lungs, which is called the apex, these alveoli are able to swell easier and are considered to be more compliant, capable of more oxygen-carbon dioxide exchange because they have a less negative pressure compared to those alveoli at the apex. Higher amounts of blood vessels are also found at the base of the lungs, which allow for a greater oxygen-carbon dioxide exchange. This mode of breathing reaches a higher oxygen saturation in the blood, which results in more oxygen reaching your body tissues. Mouth breathing can lead to cellular hypoxia because of the shorter rapid breaths, because they cause more carbon dioxide to be removed from the body compared to nasal breathing. Less carbon dioxide in the lungs correlates with a reduced amount of carbon dioxide in the blood, and this causes a loss in the amount of carbonic acid. Carbonic acid is vital to maintain the buffer balance in blood, and the buffer balance maintains blood pH normally between 7.35 and 7.45. This loss of carbonic acid shifts the blood towards a state of alkalosis. A more alkaline blood pH reduces the ability of red blood cells to release oxygen to tissues. Mouth breathing reduces the levels of oxygen and carbon dioxide at the lungs, causing blood alkalosis, therefore increasing the possibility of cells in the body becoming hypoxic. One highly bioactive signaling molecule is nitric oxide. It's one of the most overlooked benefits of nasal breathing because of its ability to stimulate one of the most overlooked benefits of nasal breathing is the ability to produce the powerful gas called nitric oxide. It's produced in the paranasal sinuses, specifically when we inhale through our nose, and it has several crucial roles in our body. First, nitric oxide acts as a vasodilator, meaning it helps relax and widen blood vessels. This improves blood flow and allows for more efficient oxygen exchange in the lungs. When we breathe through the mouth, we bypass nitric oxide production entirely, missing out on this oxygen boosting benefit. Nitric oxide does more than help with oxygen. It also has strong antimicrobial effects, helping kill bacteria, viruses, and fungi in the upper airways. So you can think of it as your body's built-in defense system. And by nasal breathing, you're essentially sanitizing the air before it hits your lungs. It also promotes bronchodilation, meaning it relaxes the muscles of the airway, and this is especially helpful in conditions like asthma. Some studies even found that nasal nitric oxide improves oxygenation in patients with COVID-19. So when we nasal breathe, we don't just get more filtered, humidified air, we also deliver nitric oxide to the lungs and body, and that's why healthcare professionals, especially in respiratory and dental fields, are encouraging early detection and correction of mouth breathing habits. Now that we've seen what nitric oxide does, let's look at how nasal versus oral breathing affects oral health, facial development, and sleep and overall health. Mouth breathing is associated with xerostoma, which means mouth dryness. Mouth dryness can cause an increase in the amounts of plaque and gingival inflammation because of this loss of saliva. That is shown in this figure here. Because in the mouth are salivary glands that are important for the maintenance of oral health. The regular salivary flow works to cleanse the mouth of bacteria and food debris, but when that salivary flow is lacking, it causes a buildup of the bacteria and debris, promoting the occurrence of caries. Chronic mouth breathing doesn't just affect the way we breathe, it also will in fact impact how the face develops, especially in young children, because most oral facial growth happens very early, with about 60% of the adult face having developed by age 6. So when a child primarily breathes through their mouth during these critical years, it can alter the facial development. We see outcomes like a long face, a high arched palate, and dental malocclusions. One reason this happens is because of how the soft palate moves depending on how we breathe. During nasal breathing, the soft palate drops forward and rests against the tongue, which helps close off the mouth airway and support proper tongue posture. But with mouth breathing, the soft palate shifts backward, closing off the nasal passage instead, and that disrupts normal airway use and development. Nasal breathing, on the other hand, encourages a natural interaction between the upper jaw and lower jaw, and this interaction helps guide facial bone growth forward instead of downward. That forward growth creates better space in the mouth, reduces airway length, and supports proper tongue position and a shorter, soft palate. All of this contributes to a healthier craniofacial and airway development. Next is low tongue posture from the mouth breathing also can contribute to a range of issues like speech delays, abnormal swallowing patterns, and jaw misalignment. These are referred to as orofacial myofunctional disorders, and they're often missed unless a dentist, orthodontist, or speech therapist is trained to spot them. So not only is there speech delays, swallowing, abnormal swallowing patterns, and jaw misalignment, but there can also be issues like chewing, occlusion, and temporal mandibular joint movement and stability of orthodontic treatment. Here you can see images of enlarged adenoids and tonsils, two common causes of airway obstruction, especially in children. When a child is a chronic mouth breather, the unfiltered dry air irritates the mucosal lining of the throat and the nose, leading to inflammation and swelling. So these structures, especially the adenoids, sit at the back of the nasal passage, and when they're enlarged, they physically block the airflow through the nose, forcing the child to breathe through their mouth. This creates a vicious cycle because mouth breathing leads to swelling, and the swelling makes it harder to breathe through the nose. Left untreated, it can contribute to poor sleep, behavior issues, and then again, facial developmental problems. And that leads us into the next slide, how these obstructions relate to sleep disorders. Many kids are being misdiagnosed with ADHD, and they actually have undiagnosed sleep disordered breathing. Children with sleep disorders often fall below their peers in terms of weight and height and often have struggle paying attention in school. ADHD is the most prevalent diagnosed behavioral disorder in children, and the current care plan for these children is ADHD medication. In many dental professionals' opinions, the ideal treatment would be to treat the blocked airway, and this could be life-changing not just for their attention span, but for growth, mood, and school performance. One major complication with obstructive sleep apnea in children is cor pulmonale, which is right-sided heart failure, and it occurs from the chronic low oxygen levels that I talked about earlier. With the poor oxygen exchange in the heart, it has to work harder to pump blood through the lungs. Nasal respiration has also been nicknamed an athlete's secret ingredient because it allows for the same amount of mechanical work done by oral breathing to be completed at a lower metabolic expense. This efficiency is likely due to the better oxygen utilization, improved carbon dioxide retention, and enhanced nitric oxide production, which can support overall respiratory function. Studies have shown that the larger the nasal airway, the longer the athlete was able to breathe through the nose as physical demands of activity increase. But there's no universal threshold for switching from nasal to oral breathing during activity due to people's different needs, but one can conclude from these findings that a nasal expander may increase the ability to continue nasal respiration during activity. There are also effects on the nervous system when comparing nasal and oral respiration. Mouth breathing shifts the nervous system into the sympathetic division, commonly known as the fight or flight mode, whereas nasal breathing encourages the parasympathetic division, known as the rest and digest mode. And the parasympathetic division is known to improve your mood, reduce stress, and enhance circulation. So for diagnosis and treatment of mouth breathing, a dentist may be the first to notice the signs like an open mouth posture, the snoring, or the enlarged tonsils or adenoids. And the next step would be referral to an ENT or sleep specialist, because when caught early, interventions like nasal expanders, breathing retraining can completely change a child's development trajectory. There are a few breathing retraining methods because chronic mouth breathing can be corrected. There are methods designed to restore nasal breathing, regulate carbon dioxide levels, and improve overall respiratory efficiency. 3 well-known approaches. First is pranayama, which is a traditional yogic breathing practice. It uses techniques like alternate nostril breathing, breath holding, and deep belly breathing, and the goal is to strengthen the diaphragm, increase breath awareness, and reduce stress. It's essentially helpful in improving oxygen efficiency and calming the nervous system. So for alternate nostril breathing, it's when you would take your thumb and close your one nostril and breathe in through the other, and then while you breathe out, you would close your other nostril, and they do that for like 3 minutes. Next is the Buteyko method, which focuses on low volume nasal breathing and breath holding exercises. It trains people to tolerate higher levels of carbon dioxide, which is beneficial because low carbon dioxide levels from overbreathing can lead to symptoms like anxiety, fatigue, and poor oxygen delivery. Potato is often used to manage asthma and sleep disorders like sleep apnea. Third is CART, which is a more clinical approach because it uses biofeedback devices like a capnometer. And a capnometer is something that, like a mask or a breathing device, which monitors the carbon dioxide levels and breathing rate. People learn how to slow their breathing and keep it shallow, mostly through the nose, and it's been used to help people with panic disorders, chronic hyperventilation, and PTSD. Each of these methods focuses on restoring nasal breathing and improving breathing awareness. And while the tools and traditions differ from yoga to tech, they all help retrain the body to breathe more efficiently. So breathing is more than just taking in oxygen. It affects everything from facial structure and oral health to sleep quality and overall well-being. Nasal breathing in particular supports better oxygen delivery, encourages healthy facial development, and even plays a role in disease prevention through nitric oxide reduction. In contrast, chronic mouth breathing is linked to dental malocclusions, poor airway growth, and conditions like sleep apnea, and that's why early recognition is so important, especially in children. Both dentists and medical providers have an opportunity to screen for these habits and intervene early. Something as simple as identifying how someone breathes can shape long-term health outcomes in a big way. What if recognizing a simple habit today could prevent a lifetime of health complications tomorrow? And lastly, I just want to thank Dr. Prusi because he was my project advisor and my academic advisor for the last 4 years, and he's kept my interest in physiology alive. That's it.